Now I'm very pleased to introduce my boss and the person whose vision and leadership is truly the engine of this project. He is someone who, I am told, Dick Gottfried said that the way to get more patient-centered medical homes in New York State is to get more Foster Gestons. But fortunately, there's only one. Dr. Foster C. Geston is the medical director of the New York State Office of Quality and Patient Safety. He's been a brilliant and persistent force behind many of the patient-centered medical home initiatives in the state over the past few years within Medicaid and in collaboration with other commercial and federal payers. He also plays an important role within the state and nationally in the quality measurement, public reporting, and improvement programs, engaging physicians, health plans, and patients. Please join me in welcoming Dr. Geston.
Thank you. Good morning. Did she say unfortunately or fortunately there's only one? I heard fortunately, which is what my parents used to say. It's great to see you all here. It really is exciting, and I think we have a great day in store for you. I want to give my thanks to Marietta and to Laura and to Aaron as well for making this demonstration so successful and pulling off this conference. It's a big enterprise. It's always a little bit bigger than I think we always estimate, but I think the results are going to be really exciting. So we have said repeatedly that the hospital medical home demonstration really has twin goals of improving care for patients seen in ambulatory training sites, and while at the same time improving the training experience for primary care physicians. And just took the time to reread the terms and conditions that we had with CMS for the whole enterprise, and I think it's just worth repeating it. The first paragraph says, the purpose of the demonstration is to improve the coordination, continuity, and quality of care for individuals receiving primary care in hospital outpatient departments operated by teaching hospitals, as well as other primary care settings used by teaching hospitals to train resident physicians. Demonstration will be instrumental in influencing the next generation of practitioners in the important concepts of patient-centered medical homes. Training sites in particular, due to the structural discontinuity imposed by rotating residents and attending physician schedules, present a significant opportunity to improve patient experience and care through residency redesign. That was our pitch then. That was our story. We're sticking to that story. We think it still has import and meaning for us here in New York. And the opportunity presented, I think, is not a small one. We have, in this project, over 62 hospitals, about 160 training sites, something in the order of about 120 separate residency programs, 5,000 primary care residents that are touched in one way by this, and these training sites serve over 1 million Medicaid members as well as patients with other types of insurance. So the opportunity really is not a small one. At its heart, when we strip all of this stuff about medical home from all the jargon, I think that we are at its core very simply trying to create the tools needed for to be able to succeed in an increasingly complex job as primary care clinicians that will allow us to deliver the kind of care that we want for ourselves and the kind of care that we want for those that we love and care about. So for today, we've invited speakers and created opportunities for discussion to explore why this is so critical to our success as organizations and clinicians, and what are some of the creative solutions that are being developed here in New York to navigate those specific complexities of training programs, and what some of the opportunities are that you've all taken advantage of. We're going to hear from state and national healthcare leaders this morning on a panel of residency program directors and administrators that represent all three of the primary care specialties in a panel discussion. They'll explore some of the common issues for their specialty and some of the unique issues that define them as well. During lunch, as Marietta said, we invite you to check out the 30-plus posters representing the experience and the results to date from programs throughout this demonstration and throughout the state. And in the afternoon, in the breakout sessions, we particularly invite you to get deeper into your own experience and to get into some of these issues in more depth and to have more interchange around medical home curriculum, care transitions, integration of behavioral health and physical health, and the implications of patient-centered medical home for pediatric and child health. So while the day is short and the hall is filled, we really want to make sure that you feel encouraged to participate and raise questions of the panel, of the speakers, and during the breakout sessions. and as Marietta said, to share and steal ideas from each other freely. As we successfully articulated to CMS when we were negotiating the support for the waiver, we think New York has a unique and a special leadership role to play for the nation in finding the solutions that we need relative to the future training of the primary care workforce. And this is a role based in part on the tremendous strength of our academic and hospital institutions in New York, the sheer percentage of the physician workforce that we train, not only in New York but nationally, and that we have both the privilege to train and also the responsibility. And we think, coupled with the significant investments that are being made, not only in the public sphere, but in the private sphere for a patient-centered medical home, I think we have special obligations. So the ability of this demonstration, I think, which is now about halfway completed, to fulfill the vision that we have, clearly depends on each of you in this room today and all the people that weren't able to come today that work at your institution. It depends on some combination of the will that you have, on leadership, on institutional coordination and collaboration, on the willingness to try new things, and sometimes you'll succeed and be willing to fail sometimes. Clearly persistence, the creation of specific and measurable goals for those things that can be measured and that are important, that you will hold yourself accountable to, on advocacy, on teamwork, and on a level of transparency for the work that you do that may be new to you.